Dr. Stephen, let's talk about veneers. Veneers, and in fact, tell us a little bit about the difference between veneers and lumineers. There's lots of talk out there, and as laymen patients, we get confused. We see advertised lumineers, we see advertised veneers, and we go, what is one? Why would I need one? It's a much more convoluted area than implants and bridges. Most of us have a pretty good idea what the difference there is to a degree, but veneers and lumineers, not so much. Tell us about it, please.
Well, first of all, Lumineers is a brand name of veneers. It's a type of veneer that's produced by a certified lab of that name. Just like a automobile might be a Chevrolet or a Mercedes-Benz, there might be differences in the quality, but they are both automobiles.
Got it.
A veneer is basically a new layer of enamel of varying thicknesses depending on the type and the brand or the need of the patient. Of course, you want to respect the integrity of the tooth, so the less tooth you take away, if you're taking away healthy tooth for a cosmetic veneer on a tooth, you want to be minimal, so you want the thinnest layer of porcelain to still give you the cosmetic effect. The Lumineers is one of the thinnest, and some people believe it is one of the most beautiful and natural looking.
And so, since it is so thin, because I know when you put on a veneer, on an average, I call those things, clip-on fingernail, but, you have to clip on tooth nail, I guess, right? You have to shave down the tooth, because otherwise you get a huge tooth in there, and this might not be so beautiful anymore. And so when you have this thin one, do you still need to shave the tooth down, or less, or not at all anymore in most cases?
It depends on the patient. Those things are so patient dependent. If you're trying to align the teeth, if a tooth is more forward than the one next to it, and you want to bring those to the same facial plane at the same level, one, you may have to hardly even take any tooth away, where another one you might have to take more away. Basically to level off the teeth so your smile, the curve of your smile is smooth. To say it another way, if a tooth sticks out, you may have to take more away to put it back to a more cosmetic level.
So is veneers or lumineers, we kind of now, I guess, established that a veneer and a lumineer is more or less the same. A little bit depends on how the teeth are. One might be more suitable than the other one. The price, I assume, is relatively the same, no? Yes?
Yes, they're relatively the same. In my office, I don't know what other offices do.
Yeah. So it's kind of like a little individual what is needed. How much, if we can do it without grinding with a lumineer, let's do it, because no reason to put a veneer on it. On the other side, if we have to grind, it depends on what it is. It's really, the patient, from what I get from you, shouldn't concern himself too much. You will be the one deciding, so to say, which brand you use, and the patient wouldn't know anyway. It's almost like which lab are you sending your veneer to. He doesn't have any influence, and frankly doesn't care. He wants to have a beautiful smile, right?
And that's what we want to do, and each tooth is individually a part of the puzzle that we put together to create whatever the patient wants, and they're informed as to exactly what we're going to do. We'll even show them a mold or digitally what it will look at the end.
Beautiful. Now, what are some of these things? Like, for instance, a person has a couple, 2, 3 crooked teeth, and he really doesn't want to use any orthodontic work, even an Invisalign type of work, because he wants it tomorrow. I would be such a guy. You know what I'm saying? Veneers are used a lot for, using straightened out teeth, or is it only for the crooked teeth, or for the broken, or for the very yellow or discolored teeth?
Veneers, crowns, any type of porcelain work can be done to accomplish exactly and any one of those problems that you mentioned, whether it be discoloration, misalignment, spaces between teeth. Again, it's an individual thing, and sometimes it's a combination of solutions to create the final end product and what we want and our desired solutions.
Right, so you could be like doing maybe a little bit of Invisalign work, and at the same time one or another tooth might need a Lumineer or a veneer in order to give it that last, it's too much to move or whatever it may be.
Exactly.
Correct. Well, all right. Anything else about veneers or lumineers which you think as potential patients should know?
Nothing other than it's an individual thing, both individual for you as a patient, and it's individual for each of your teeth, what the solution is. But we'll work that out with you, and you'll know exactly what we're doing.
Well, it's now, I don't know, 12 years or so, I got about 4 lumineers in front, and it's not that my teeth were really ugly or so, but one got a little bit brownish, God only knows why. I guess you probably know, I don't. So it's not just that God only knows. But in any case, the smile, there was a big difference. Even now I still go, wow, it is a big difference. So do you find that patients who walk away with whatever 4, 5, 6, lumineers, crowns, whatever it is, in the front, where their teeth all of a sudden are what they kind of imagine to be a nice smile, like a Julia Roberts smile, a Tom Cruise smile, that all of a sudden they go, wow, and their life changes and they just bloom up and walk 6 feet taller, maybe 6 inches?
Absolutely. Somebody ashamed of their smile who never shows their teeth or holds their hand up against their face when they speak to others, they walk out of here grinning from ear to ear like the Cheshire Cat.
I guess it's priceless. Those type of things really are priceless.
You can't put a price on those smiles and the hugs that come when we're done.
Wonderful. Thank you very much, Dr. Stevens.